in the Philippines, very small amount of investment is putting into the technology. I mean, in the IT perspective, with the different hospitals or even industry players. So they didn't put that much of investment. Luckily, in TMC, we are focusing heavily on this investment because we wanted to make sure that we will be the first mover within the industry to demonstrate that the medical city is willing to make a lot of investment and also to align with the changing environment and the fast pacing of the technology, and therefore we are heavily investing into that. The fundamental requirements is the infrastructure as the backbone in order for us to implement a lot of solutions. So currently we are doing one of our ambitious project is actually implementing an EMR into every hospitals. We are unifying and harmonizing all our electronic medical records. And the moment we make that successfully implemented across our hospitals and clinics, we will be able to achieve the electronic health record, which never been implemented in the Philippines and also never been into the Southeast Asia in that scale. So we wanted to be the first to implement the electronic health records, which actually even the government or the DOH can actually use it as a benchmark, or they can use it as a reference. That's the Project Polaris that we are actually implementing. And the moment we achieve that, we will have one patient record in any place in the Philippines, as long as you are within the TMC network. So for example, if you happen to be in Manila and you have procedure or you have a consultation or anything that you engage with TMC, but then you went to Cebu or you went to Davao, your records will be available also to the doctors and also to you at any given time. The doctor will not necessarily ask you what's your allergy, what were your procedures, or what were the medicines that you have taken, because all of these are immediately available through our EMR, electronic medical records. So we do a lot of parallel work, parallel executions, as well as parallel initiatives. All of these are actually intended and intentionally as an approach, because if we don't do the agile methodology, the adoption would be very slow and the implementation would be very slow also. And having said that, we are also harmonizing our backend, our diagnostics devices, and also equipment, where we are standardizing and harmonizing the devices and also the equipment, so that we have this uniformity across the group as well as within the network. So it simplifies the learning curve, as well as it also gives an opportunity for every employees or staffs or doctors within TMC to have an ability to quickly perform their job without really necessarily learning or understanding what's the setup or configuration or devices in other hospital, because the only thing that they need to know is to navigate the building. But the solutions, the devices, the equipments, we are standardizing that, and also the process, we are standardizing that to make it easier for everybody. So the automation actually addresses two primary concerns. One is the data accuracy and data consistency. The reason for that is because if there's so much of human intervention, there will be a high possibility of a typographical error or some human errors that will gonna appear into that. Then second is also the productivity, and to avoid for our nurses and our other ancillary staffs to do those clerical works, because that's not their job. Their job is to be with the patient and focus on providing the patient's care. For those repetitive tasks, or mundane tasks, we don't necessarily them to spend all those, you know, time and efforts. For one, it will be frustrating for a licensed nurse or a licensed technician or readers or whatever within our ecosystem to just be doing those inputting of data. So we wanted, this is our small way of, you know, giving them more value into their profession. Our focus is more on preventative because as much as early stage, we wanted to predict and to prevent all of these things. So that's why one of our initiative also is actually to have a digital twin. So we're actually building a digital twin in a sense that we can actually predict through the early symptoms and all early detection of your procedures and outputs. We can actually map it, and we can tell you in 5 years or 10 years from now, if your habits and if your findings is not changing, we can tell you that, oh, you will have this kind of sickness, you will have all these things. We are also building a super app where the patients can reach out to us, where if you find the wherever you are located, let's say for example you are located in Quezon City, our app will intuitively give you the proximity of the nearest hospital as well as the nearest clinics. It will tell you where you should go, and it will also guide you to be able to book your doctors and also book your diagnostics testing. And you don't have to queue from 5 a.m. Staying in the hospital, just wait for your slots and all of this, because you can have this scheduling, you know, within your availability, and also manage your time, because we are very sensible on making sure that the patient's experience will significantly improve.